Anestrus, no estrus, no cycle, no ovulation, and no possibility of conception, but what exactly is happening inside the body, and why does this condition occur? Let's understand this step by step in a clear and logical flow. First, the definition. Anestrus means absence of estrus cycles. The ovaries are inactive. There are no ovulatory follicles and no functional corpus luteum. The main reason is insufficient secretion of GnRH from the hypothalamus. Because of low GnRH, the anterior pituitary does not release enough FSH and LH. Without these gonadotropins, no follicular development and ovulation occur. Now, before going further, it is important to classify anestrus. There are two types. True anestrus and apparent anestrus. True anestrus is due to real hormonal deficiency. GnRH secretion is low. This can be caused by poor nutrition, stress, pathology, or lactation. Management focuses on correcting these factors. Improve nutritional status, reduce stress, and treat any underlying disease. On the other hand, apparent anestrus is not a hormonal problem. The animal may actually be cycling, but estrus is not detected. Or the animal may already be pregnant. In this case, the solution is improved estrus detection and accurate pregnancy diagnosis. Now, let's move to a major physiological cause. Gestational anestrus. During pregnancy, anestrus is completely normal. Progesterone levels remain elevated, that exerts negative feedback on the hypothalamus, inhibiting GnRH secretion. As a result, inhibiting FSH and LH. Therefore, estrus cycles are suppressed during gestation. Next, let's move to postpartum anestrus. After parturition, progesterone declines rapidly and estradiol increases, but the female does not immediately resume cyclicity. This period allows time for the uterus to heal before the next estrus cycle begins. The duration of postpartum anestrus varies among species. Now, moving to seasonal anestrus. This is another normal physiological condition. It evolved to ensure that conception and parturition occur at optimal times of the year. Environmental factors such as temperature and nutrition play a role, but the most important factor is photoperiod. Animals are classified as long-day breeders or short-day breeders. Long-day breeders, such as the mare, begin cyclicity when day length increases in spring. Short-day breeders, such as sheep, goats, and deer, begin cyclicity when day length decreases in autumn. This ensures that parturition occurs during spring when environmental and nutritional conditions are favorable for survival of the neonate. Next, lactational anestrus occurs during lactation and prevents pregnancy while the offspring is dependent on the dam. It is not due to suckling alone. Although suckling lowers LH, sensory inputs like visual, olfactory, and auditory signals from the offspring also suppress GnRH. In cattle, the dam's own calf is critical, removing or replacing it increases LH and resumes ovarian activity. Dairy cows have shorter anestrus because calves are removed early. Finally, consider nutritional anestrus. This occurs due to negative energy balance. When energy or protein intake is insufficient, GnRH pulse frequency decreases. Nutritional anestrus is especially common in high-producing dairy cows and primiparous females. These animals have high energy demands for lactation, and in primiparous animals, additional energy is required for growth. If nutritional requirements are not met, cyclicity is delayed. Restoration of adequate nutrition leads to resumption of estrus cycles. An important concept here is silent ovulation. For a better understanding of silent ovulation, check out our dedicated video on it. So, to conclude, anestrus is not always pathological. It can be a normal physiological state during gestation, postpartum period, seasonal transitions, and lactation. However, it can also result from poor nutrition, stress, or disease. The key is to evaluate the underlying cause systematically. Thanks for watching. Make sure to like, subscribe, and hit the notification bell for Vetcare.